I talk to patients about knee pain and activity and when to return back to activity. Pain is generally the guide. I think if you have a knee injury or any joint injury for that fact, a certain degree of rest is important, but too much rest is just as bad as too much activity. You need to stay active. You need to stay mobile to help with some of that knee pain. The traditional teaching of RICE, rest, ice, compression, elevation, there's something to be said about it, but there's also some things to say against it as far as if you have an injury to your knee and then you decide to spend the next 3 weeks on the couch because of that, you've actually probably gone backwards on that injury and that progression to health than actually gone forward. It's the same example I use as far as an automobile. If you got worn out tires, you certainly don't want to run it on the racetrack as hard as possible, but you also don't want to be sitting in the yard rusting it out. So you got to be moving and doing something.